Let's bring in Dr. Dara Kass. She's an ER doctor and medical contributor for Yahoo News. Doctor, thank you for joining us.
Thanks. I'll be a reporter if he wants to be the doctor for the day. It's okay.
No, I want you to be the doctor, which
Okay.
you are. The first U.S. case of the new and highly contagious coronavirus variant has been reported in Colorado, as you know. We know it spreads more easily, but what other key things do people need to know about this strain?
So this is the first known case, but unlikely to be the first case, especially since this one individual did not travel from the UK to the United States and likely got it in his own community. This highlights a lack of genomic surveillance, which means that we haven't been testing the swabs of positive people for new strains and understanding how many of these new strains have been coming into America. So we're hoping that we start to do more of that now. What it also reminds us is no matter what this strain does, it still stops spreading when we do the same normal public health measures that we've been asking people to do, which is stay distanced, wear a mask, wash your hands, and test yourself if you're positive. Those same measures will work for this new strain. So please don't get freaked out. Just stay distanced, wash your hands, wait your turn to get vaccinated, and please stay with your nuclear family, and we'll get through even this new strain together.
You know, for the past few weeks, we've been reporting the concerns of a holiday surge on top of an already existing surge in the United States. And as an ER doctor, what are you seeing on the front lines, and what's your message to people ahead of the new year?
So look, the front lines are not good. I work in New York City. We had obviously our large surge in March and then in April, and we're seeing increasing cases all over our hospitals in New York now. But the difference this time is that we have a huge baseline increase in the number of cases, and obviously there are cities and counties in the United States with literally 0 ICU beds. What this means is this virus is everywhere. It will penetrate any bubble. It will find you where you are if you're not careful. This virus doesn't care about your politics. It doesn't care how careful you have been. Every day is a new chance to let this virus into your family. So please, please, please be diligent as we start to vaccinate Americans, because we are so close to the end of this pandemic.
Speaking of politics, yesterday President-elect Joe Biden criticized President Trump for falling behind on the coronavirus vaccine rollout. He said only 2 million people have been vaccinated, far short of the 20 million President Trump promised by the end of the year, which is tomorrow. Even with new vaccines coming down the pipeline, where do you believe we've gone wrong? And what kind of timetable do you think the nation is looking at in terms of widespread vaccine distribution?
So where we've gone wrong is we've overpromised without delivering any infrastructure to support the delivery of vaccines and vaccinations to communities. The idea that you can drop the vaccine at the doorstep of states and then let them burden them with the distribution plan without any resources was never going to work. And a lot of us knew that from the beginning. We're falling short by a score of tenfold from the promises, the lowest promises this administration has ever given us. So hopefully with the next administration, there will be not just a delivery of resources, but also operational planning to make sure that President-elect Biden can deliver his promise of 100 vaccine shots in arms by the end of his first 100 days.
Dr. Dara Kass, thank you, and thank you for being one of the heroes on the front lines.
Thanks for having me.